going to make my own path. And it's like, no, there's a path for you for a reason. You know,
there's a reason for everything.
Yeah.
So if you're good with that, we will
get this started.
Get off and
ready to
run.
go.
Okay.
And we'll cuss this time just for you.
Yeah. Like, what the fuck?
Yeah.
What the fuck?
Yes.
There we go. Get it out of our system.
Yes. All right. Or get it into our system.
Oh, true.
Right on.
Yeah, true.
Right on.
All right.
Do
Okay.
it.
All right. Count us down. Guess what, guys?
We're not doctors.
No, we are not.
If you're going to be making any major medical decisions, please consult your doctor.
That includes diets, exercise, medications, and surgery.
We love you guys.
And we want you to continue to be in our OSLP family forever.
So be careful and consult your doctors. Guys, we all need our vitamins after surgery, regardless of what you think.
Yes.
It's a must.
Yes. So why not choose the easiest and the best tasting in the community?
Seriously, it's ProCare, guys. ProCare
Yeah.
is so delicious. I use their chewable for over a year. That's how I know.
Yes. And I love their capsules.
Yes.
Love them. They're
Yes.
once a day. I take them at night. Easy peasy. And my labs are fantastic.
Yeah, our labs are great. And I've actually switched to the capsules and I take those at night now. So
Yes.
if you guys need your iron, they have them with iron and they have them iron free. They even have calcium chews.
Yes. The calcium chews. Perfect. They have mocktail ones, chocolate. They have also some caramel and a cinnamon roll.
They're freaking delicious. So go over to procarenow.com and use our code OSLP to save some money.
Prepping and measuring your food post-op is a beast all in itself. But Portion Perfection has actually made it super, super simple. They have bowls, plates, and even a lunch bag called the Kitten Carry where you can have all of the system ready to go.
Yeah, we love carrying that thing around with us. It's so much easier to pack your lunch, your snacks, especially when you're on a road trip. That thing is a lifesaver.
Yes.
So if you want to get these things to help your journey, just go over to portionperfection.com and use our code 15OSL pod. And again, that's 15 OSL pod. And you can also go over to our Amazon storefront to pick out any of those that you would like to use.
All know how difficult post-op life can be.
Yeah, it's pretty freaking hard, guys.
Yes. And so a way to make it a little bit easier is by joining the TRIBE membership program. It has been created by a registered dietitian. She's actually the sleeve dietitian on Instagram. Her name is Jamie. And she's created this whole membership program just to support us.
Yeah, like we've had her on the podcast. We love her to freaking death. And then two, like she has full experts in their field that help you. And they've had bariatric surgery, almost every one of them.
Yes.
And the sleep dietitian is freaking smart because she has almost a support group every single day, guys.
Yes.
You're going to get an email. It's going to tell you which ones are for today. And you can just sign up and hang out with people that are just like you. And I've even used the journal prompts. I'm into journaling, and that was way helpful to just go somewhere that can help you and just get your mind going.
Yes.
So if you need this kind of support, which a lot of us do, go to her website and use our code OSLP at checkout to get your discount. Welcome back, OSLP family. Yeah. Welcome.
You are listening to our Sleeve Life podcast, and this is Kelly.
This is Mel.
And you guys, there is the award show.
What? There's an award show?
I know.
No way.
It came out of left field. There is an award show. It is called the Just Be You Bariatric Award Show.
That's right.
It is going to be in Washington, D.C. this year.
Right. This is the second year running.
Yes.
And for those that for some reason don't know what the Just Be You award show is, it's a People's Choice Award for our community.
Yes.
So back in April, we decided to open up nominations for a full 30 days.
Yes.
So right now, we're calculating all those up.
We
the
are.
top 5 get to be in their categories. There's 26 categories this year.
There is. There's 26. I can't believe
That's
it.
right. One category for every letter in the alphabet. That's what we did.
That is true.
Yeah.
That is true. And we could not do 25 because Mel likes even numbers. So we did 26.
That's right.
And who knows? Next year we might have 28 or 30.
Oh my goodness. It's going to be wild.
But it is going to be on September 30th. Yes. It is a full weekend of festivities.
Of course.
We have some things planned that we are slowly rolling out as we get them confirmed. But we have so much fun planned. And the night of the award show, it is not just the award show. You get to come in walk the pink carpet, get your photos taken. Then you get to go and watch the show, which is hello. That's why we're all there.
Yep.
And then after the show, there is an after party. There is catering. There is a DJ. There is a dance floor. There are 2 bars.
That's right.
There are so many things to do during this. And we are going to have a photo booth.
Yeah.
Maybe something else fun that
Maybe
includes videos, photos, something like that.
Yeah.
And you can still walk the pink carpet after and take photos again if you want to take photos with your group. So much fun planned. So you definitely do not want to miss this. Tickets and all the information you can find on jbyawards.com.
That's right.
While you are on your computer though, or your phone or your tablet, go to oursleevelifepodcast.com and you want to sign up for our newsletter. And I will tell you why. Because you get a free ebook.
You do get a free ebook, and you also get updates about us, what we're doing.
The award show.
We get stuff about the award show. You get to hear about our patrons, which if you don't know what a patron is, they actually get discounts to the award show.
They do.
They also get to have a rooftop brunch on Sunday.
I know we're crazy over here.
I know, but we
are making it happen.
Yeah, we like to give back to our patrons because we wouldn't be able to do this if it wasn't for you guys.
Correct.
So all of our Benchies get to have a Benchy brunch on Sunday after the show. It's going to be so much fun. So if you want to become one of those, that is patreon.com/OSLP. Pick at least $7 or higher. You get your discount to go hang out with us, and you get to have a Benchy brunch for free.
Plus, when you sign up for that level, you get the Benchy support group.
That's right.
And the Benchy support group is full of people. There is over 260 people in there, and all of them are so bonded at this point. They all know each other. They talk back and forth. They share photos.
Well, and they're super unique because we have all age ranges. I think the youngest we have is like 24, and then the oldest is like 60.
Yes.
And we have men and women. And so they actually get to connect on a whole different level than I've ever seen.
And they find their very besties in there.
Yes. And
just
they're
like at the
twinsies.
JBY show.
Twinsies too.
And twinsies, yeah. So lots of fun over there, lots of information over there. If you're having an issue, ask a question. Every question is open to ask over there.
Yep.
And then also you want to go to our YouTube.
Yeah, because that's a free way to support us. So if you can't support us monetarily, we totally understand. But yes, go to YouTube. It means more to us than you. You just hit the bell, hit the subscribe, and then you get an actual video every single Tuesday morning. You wake up to a video of us.
A video of us.
And then sometimes we have guests and sometimes we don't. But today we do.
Today we have a guest.
Yes, we do.
And we are super excited because he is the president of, used to be the ASMBS Foundation.
Yes.
But we have a new name.
Yes, we do.
For them. So let's introduce Dr. Carl Pesta himself to tell us what the new name is. Thank you so much. Thanks for being on.
I'm so happy to be here. Thanks for having me back. It's such a pleasure.
Of course.
It was great to see you in New Orleans and great to see you again back on the computer screen. So thank you so much for having me.
Thanks for being on. Yeah. And oh my gosh, New Orleans, you're singing, and then
always a pleasure.
Always a pleasure. And then we loved having you like as our commentary when we judged the costume contest. Oh my gosh, that was so fun.
We need you at all times for that.
Yes.
Because that made that 10 times more fun.
Yes, exactly.
I always say I'm an entertainer, but I need to do surgery to pay the bills. So you know what I mean? So
that's fair.
Someday,
I believe it.
I hope to retire on a cruise ship, like a ship's doctor by day and the lounge act at night. I think I can just tour the world. I'm looking forward to it.
Oh yes, that's a perfect retirement.
I can see you doing it because you do really good Frank Sinatra songs.
Yes.
I love it.
Oh my God.
He's over my shoulder.
Yes,
right
he is.
Always watching over me.
Yes, I love it. So
right
there has been some changes with the ASMBS Foundation.
Absolutely. Yeah. So the ASMBS Foundation, we've been around for 25 years, raising money and funds for research. And really it's the number one supporter for research for our national society, the ASMBS. But what we always found, even though we've been around for so long, when we try to talk to people about what is the ASMBS Foundation, if you're talking to somebody who's not familiar with weight loss surgery or the society in general, that 10-second elevator pitch is really tough because first you'd have to describe what is ASMBS, what is weight loss surgery, and then you'd say, okay, we're the foundation that supports that. So through multiple people, started with the brainchild of Dr. Rami Lutfi out of Chicago. He's a great buddy. He was president of the foundation when we got this going. And then he just said, we got to change the face of what's going on with the foundation. Let's brighten it up. Let's make it more apparent as to what it is. So that kind of kicked things off a few years ago, and we've been working through this process. Well, through a rebranding company, we worked with them for almost a year to talk about, how are we going to make this so that the new name tells what it is, tells us, tells everybody what we are, what we do. And lo and behold, after all these meetings of, what's important to the society, what's important to the name, we came up with, drum roll, please. The TREO Foundation.
Yay!
TREO Foundation.
It's so cute.
TREO.
I love it.
Yeah. So TREO versus, how you normally spell TREO, but TREO. And what that stands for is treatment, research, and education to end obesity. So treatment, research, education to end obesity. So TREO. And so now you can say right off the bat, the TREO Foundation, well, basically we raise money for treatment, research, and education to end obesity, whether it's surgically involved or not. And so I really think with the new logo, with the new name, people are getting a great idea about what the foundation's all about. And so super excited. We just had our rollout. We've got all kinds of rebranding stuff coming out there, and it's been really exciting.
Oh, it looks amazing. I love the new logo. I did not realize that's what it meant. And I'm like, I got full body chills when you told me, because that's exactly what you guys do, is try to end obesity through treatment and education and research. So
it's perfect.
I love it.
We're really the only one that supports, from a standpoint of supporting surgical types of issues, so it fits in very well with the society. Our money that we raise annually will, we give out currently about $50,000 in grants, usually two $25,000 grants. So what that means for people is that, we've got wonderful clinicians throughout the country, and they want to do some research on, let's say, a new medication that may help after surgery, or a new process that may help during surgery, or a new device. And so in order to perform these research endeavors, they have to have funds to do it. And so a lot of people they don't have that opportunity. So we start with seed money so that people can take their idea. Let's say they need to create a bunch of flyers to give to the patients to just monitor their symptoms, and whatever it is they need to get that started. We are able to support that through these grants. So like I said, we've been doing two $25,000 grants a year. We did just support a very big endeavor last year that I'd love to tell everybody about. That was called the NORC Survey. So the NORC Survey is out of the University of Chicago. And what they do is they interview thousands of people throughout the United States. So it's not put on by the society. It's done outside of the clinicians, because some people say, well, if it's put on by the physicians, they're going to kind of skew it their way. Well, the NORC Survey is very well known for how it handles it. It just asks the general public, what is your ideas of obesity? How has it changed since the pandemic? Because we know there were so many issues associated with the pandemic. And so what we found is that, more and more people are realizing that the disease of obesity is impacting their overall health. And of course, when it came to the pandemic, we knew it was one of the primary factors in early mortality, or dying from COVID, and developing all these other symptoms. So what the NORC Survey did, that was funded by the TREO Foundation, $70,000 grant actually. It basically, it showed that, yes, we need to continue to address this disease process. We know that surgery is the best option for that. And it just really made an impact. So now it's being through the NORC Survey, it's being broadcast into, News and World Report. It's hitting the mainstream media, not just the periodicals and the journals that we as physicians read, but really for the general public.
Right.
And it kind of shine a nice spotlight on that. So
that's amazing.
That's what we've been doing with our funds.
Wow. That's incredible. I love
Yeah.
that you guys do so much for us as patients to get it out there. Cause that's our whole mission, is to get it out and have people realize that surgery is an option. It's not as scary as they think it is. And knowing that it saves lives.
Well, and it's okay if you need it. I think that's the
it's not a
biggest deal,
failure,
because obesity is a disease, and we know more and more about it now. And with you guys actually bring more light to it, because when I talk about obesity, people still think like, oh, that's just because you guys are lazy. And I'm like, oh, if I could just like school you right now, I would tell you all of the things, because people don't realize that it is an actual disease, and that once you hit a certain barrier, there's not much of a return. It's almost like just having diabetes. So it's like we need to be treated the same. So
we found a company that was founded by a bariatric surgeon for his patients. He is just trying to make their lives easier. And so they have created a whole array of snacks and dinners and just all the foods you could possibly want that have protein in them and are delicious.
Yeah. And they're so freaking good that we took them on tour with us, because we tried them on a live. So you guys can always go back and watch that. And we liked every single bar.
We were shocked.
We don't want you guys to miss out. So go over to Barilife.com, use OSLP, and get your discount.
While we were in Florida, we got to visit one of our favorite bariatric surgeons, Dr. Donald Fridley at Surgical Associates of Bayonet Point. And when we say that they are patient focused, they are patient freaking focused. They tailor make all their plans to the unique needs of each patient.
It's an in-body scanner.
We both got to use it.
We both got to use it, and you get to do it pre-op and post-op. So that way you can see all the differences and all the changes that happen. And he's also one of the surgeons that does his surgery with robotics. And we got to play with that
We
too.
did.
So we
was so cool.
We were so excited, and we want you to have such a special care that they give. So go over to SABPweightloss.com right now.
Or give their office a call at 727-819-9107.
That's right. So, and tell them that the OSLP girls sent you, and they're going to take great care of you.
Yeah.
I agree. And that's really a big push from our society and our society is called the American Society for Metabolic and Bariatric Surgery. So we, years ago, we put in the metabolic term because we realized that it has such an impact on overall health, from high blood pressure to diabetes to sleep apnea. And it can really treat and cure a lot of these processes that go along with it. So I think it is so important that you continue to share that message. There's so much research. And again, these are some of the research studies that we do as far as, what it is and how surgery does affect our hunger, how it does affect our hormones after surgery, about how the things that drive the disease of obesity are reversed through surgery. So it's changing of hormones, it's changing of our gut bacteria. And we've got the research that proves that it's so much more than just lifestyle modification. The surgeries actually correct deficiencies or problems that occur in the body that cause the disease of obesity. It's really important.
Well, and not to mention, my autoimmune diseases, they got so much better once I lost the weight. So it also helps with overall chronic pain. It helps with, because my sciatica was crazy before. I couldn't even stand for 10 minutes before surgery. And then after surgery, I was walking the halls. I had no pain. So, and once the weight started really falling off, then it was an all over pain relief for me. So it helps not only, diabetes, high blood pressure, all of that, but for us that have struggle with autoimmune, it helps with that also. So it's a lifesaver.
It really is.
I recommend it, highly recommend it. And then speaking of that, we were going to talk to you about why we do the order that we do after surgery.
Yes. And please tell our audience that don't know you, what is your surgery background? How long have you been a surgeon, and what you do on the daily?
Yeah.
Absolutely. Yeah. So my surgical practice, I graduated residency in 2001.
Okay.
And gosh, it's hard to believe it's been that long already.
Right.
I feel like I'm getting younger, but with the years come experience. And so over 5,000 procedures. I do all types of bariatric surgery, from gastric balloons to gastric bands to gastric sleeves to gastric bypass to the switches, now more endoscopic procedures. But the bread and butter of our bariatric practice is still pretty much the gastric bypass, the gastric sleeve. I did 4 gastric sleeves today before we got a chance to talk. So we've got 3 new sisters and 1 new brother in the community.
Yay!
Yeah. So it was a nice busy day, but really my passion is with aftercare and working with the patients. There are some programs out there where, and everybody's different, but where they may have a surgery and then they don't necessarily see their surgeon. I see my patients lifelong. I think long-term continuity is so important. Some people have primary care doctors take care of that afterwards, or bariatricians. So every practice is different. But me personally, I love to, see the patients and be with them because it's so much a part of what I enjoy about the practice. I mean, I enjoy doing surgery, but more importantly, like the events we did in New Orleans, like I hope to do with you in DC, is really the celebration of what comes along with it. I mean, when they ask you why you want to go into medicine, it's the first question they ask in your medical school interview. Why do you want to go into medicine? And I think most people say this, like, I want to help people, but I can't think of a better profession than a weight loss surgeon, bariatric surgeon, who really, you already explained it, Kellie. It's just like, things that change afterwards and how your life changes. And oh my gosh, I mean, I can imagine that for some of the, cancer surgeons, how they may be saving lives like that. But when people change their surgery, their birthday to their surgery day, and I mean, it's just so rewarding to me as a clinician. So, I mean, that's my practice in a nutshell. I do some cosmetic procedure as well for like skin removal after surgery. I do the endoscopic stuff as well, but it's just my passion for it that keeps me going, and I absolutely love it.
Yeah, I think it's bariatric surgery is one of those things that you see slight physical changes with when you cure cancer and all of that. Or you beat cancer, I should say.
There's no cure.
But I think with bariatric surgery, you're literally seeing somebody physically change over the span of it.
Yeah, you get to watch us mentally and physically transform.
Yes, transform. That's a good word.
Because
I like that.
we are changing at a crazy rate.
Yes.
Especially that first year. And every surgeon we talk to, they're like, this is the best career to ever have. Like, because you actually get to talk to the patients and see the progression unfold in front of you. And it's not like where you just do the surgery, like a gallbladder, and then they're gone and you don't see them ever again. Like, this is an actual, like, you get to watch. And so I love the fact that you are hands-on, because you're right. There is other facilities that don't, but I feel like we're more successful when our surgeon's involved, to be honest with you.
Yeah. And you guys have seen that with the follow-up and that time. I mean, there's even research, getting back to the importance of research. We look at the importance of long-term follow-up, continuity of care. There's nothing like walking into your surgeon's office and stepping on the scale and, just a little dose of reality, how you've been doing with your nutrition, how you're doing with your physical activity, all the things that, go along with supporting. We see a 10% improvement in overall outcomes in patients who have long-term relationships, not necessarily with their surgeon, but with somebody who's keeping track of their long-term care, making sure you're getting your labs done, that you're, sticking to some type of nutritional plan, sticking with the exercise. So again, that long-term follow-up with either your surgeon or someone else in the program is really important.
Yes, for sure.
We are all about the follow-ups and the post-care.
Yes.
Because even us, we're not going to lie. Like, I've missed a couple blood draws.
Yeah.
I know Kellie has yet to do hers for the most recent one. So
I know.
It happens. We're human, but you have to keep going. You just have to make sure you go to your appointments or reschedule your appointments. I always say never cancel your appointment.
Just reschedule it.
Always reschedule.
Yes.
Because then it keeps you in line and gets you on the books.
See, my problem is that she gives me the order for the blood work and then I put it in my car and then it
sits
disappears.
There.
And then I forget. And then then the next time we talk to a surgeon like yourself, then I'm like, oh, damn it. I haven't done that yet. I should probably do that.
Ooh, Kellie. Ooh, Kellie.
I know.
I
Hey,
love it.
at least mine was in April. So it's not too long.
That's true.
Not too far.
But yeah,
fair. That's
it's
fair.
I still need to get it done. So I'm reminded once again, blood work.
There we go.
Got to get my blood work.
So can you explain to us like the diet that we have to be on and the exercise routine and why things are in place the way that they are and why they're important?
Why is there a system to it?
Mm-hmm.
Absolutely. So, and first thing I want to say is, I think nearly every surgeon, every program is different. With, there's some basic guidelines that I think most people follow, but it, may vary. Some people are very regimented. Okay, it has to be, day 1 through 5 is X, and 5 through 12 is whatever.
Okay.
I think most importantly, if you're going to a reputable program, the surgeon with a good experience, and they're going to have some type of program, and they're going to have it documented for you. And I think that's most important, that you find a place that they're going to give you some type of either education before, after, or during, or all of the above. That's going to take you step by step through. And like I said, I may be different from another surgeon down the road, but my patients are going to tend to follow my recommendations. So for instance, my program is basically, oh, I got a pager going on over there. Sorry about that.
No, you're good.
But my program is basically this, is that when you wake up from surgery and we start our patients on clear liquids. So clear liquids are basically anything you can see through. It's going to be water, diluted juices, some Jell-O, maybe some sugar-free popsicles. And I keep patients on that really for the first day or two while they're in the hospital, just to make sure that, they're able to tolerate things, that the fluids are staying down, they're not nauseous, they're not vomiting. I mean, the surgeries are so safe these days. The likelihood that they're going to have any issues immediately is very low, though it can occur. We want to make sure that things are moving through. For instance, in a gastric sleeve, those first 24 to 48 hours can be pretty lousy with nausea. And that's just basically, we've basically taken the stomach, the size of, some people say a football, the size of a 2-liter, and we've taken it down to the size of a banana. So, not only that, but when we operate on the body, just like if you turn your ankle, there's going to be some swelling. So a sleeve is going to naturally have some swelling. And so it may be a little resistant to something going through. It's basically a tight tube that isn't going to let a whole lot through there.
Yeah.
So we want to first start with clear liquids, make sure that that's going down. If patients are tolerating that, then I'm going to send my patients home, usually either, the next day after surgery or 2 days after surgery. And some programs are even sending them home the same day of surgery.
Yes.
That's something that's kind of new in evolution, and varying people, different aspects are people are eligible versus not.
Okay.
But so start with clear liquids, make sure things are going through. Then for about the next 2 weeks in my program anyway, some people do it longer, some people do it a month, some surgeons do it longer, but I go on full liquids. And so this is when you start to introduce your protein drinks, maybe some high protein puddings, maybe some really runny cream of wheat, just basically nothing without any texture. It's kind of like something, just about anything you could take through a straw.
Okay.
And what that's starting to do is, it's introducing more protein. It's introducing more nutrients through the beverages, but it's also starting to test the waters, like how are you going to tolerate things with more consistency?
Okay.
So is that something kind of like how you guys followed along? Is that similar?
Yeah. Mine was, I did the 2-week liquid diet before surgery. And then I did 2 weeks, and then it was clear liquids when I was in the hospital.
Yep.
And broth is in that clear liquid, right?
Correct.
Okay.
Yes,
Okay.
yes.
I just want to make sure.
I was like, I had broth.
I want to make sure. I mean, obviously it's fine.
Yeah.
But so then I had 2 weeks of liquids, 2 weeks. And she did like soft foods and purees kind of together. She was like, basically a week of pureed and then a week of soft foods for me. And then I could graduate to whatever I could tolerate that was solid.
Yeah. And mine was a little different. I only had a 24-hour fasting the night before. And then I started completely like the clear liquid thing because I was there for 24 hours. And then the next day we could finally start doing just liquid. And it was 2 weeks of liquid, solid 2 weeks of puree, 2 weeks of soft foods, and then I could go into solid foods.
Yes.
So, and I liked my transition. I felt very good with my transition. But once I hear everybody else's, I was like, why did I have 2 weeks? Because think about it, purees and soft foods are kind of the same, but not.
Yeah.
But I did a full 4 weeks of that. So
yeah, I still remember my first bite of eggs for soft food. And I was just like, this is the most amazing thing ever.
Yeah.
I was so glad to have something of substance because I ate a shitload. I cussed. A shitload of those sugar-free popsicles. Like they were like a lifesaver for me when I was on that.
Once I got to like purees and soft foods, I ate a fuck ton of beans.
Oh yeah, beans.
I was
beans
a
and cheese.
Beans girl.
Beans and cheese.
How many beans did you say?
A fuck ton.
That's what I thought you said. That's a lot of beans.
That's a lot of beans.
Yeah, and obviously it was not that much because
it was like 2 spoonfuls at a time.
2 spoonfuls and then you're done. You're full. Yeah.
I do have a question about that. So while we're doing these like you know, the tapering, right? What is that kind of happening to like your what is that word? The M1.
More context.
I know. It's in the ASMBS thingy. It's metabolic.
Metabolic.
Yeah. What is it doing to your metabolism or even like your brain, like trying to figure out what the hell's going on? Because now you gave it food and now you don't. Because like
what do you mean by tapering?
So we're tapering up to solids. Like, so what is that doing to like our brain chemistry or our just physiological chemistry?
I think a couple of things, and you guys said a lot of great things that triggered my brain. Let me just back up just a little bit because Kellie, you said you did the 2-week pre-surgical, and now you said you just did 24 hours.
Correct.
One of the things I really believe in that pre-surgical diet, and people are different. And obviously, you prove that you don't necessarily need it. But let me explain why people might be put on that because when we go on a high protein, low fat, low carbohydrate diet prior to surgery, we notice that the liver shrinks down significantly. The intra-abdominal fat shrinks down significantly as well. And that's where we lose weight first is intra-abdominally, not necessarily, the rest of us. So what that does for us as surgeons, it gives us better view. We're able to elevate the liver out of the way a little bit better. So better visualization, better manipulation of the anatomy inside the abdomen. And so that's why some people say that. And I say, the longer the better. Ours is standard 2 weeks prior.
Okay.
But, if I see somebody and they're having surgery in 4 weeks, I say, start now. It'll kind of get used to that protein, stuff going on. Okay. And like what to expect afterwards. So that's point number one. If you're recommended to do that from your program, I would certainly say I've found it to be one of the most beneficial things that are going to help the patient have a safer surgery. So I really encourage people to do that.
Okay.
And then next was Puree. So, it depends. Some surgeons are very specific. We want you to put this stuff in the blender, and whatever you can put in a blender, then you can go ahead and take that in. I don't necessarily. So I go from full liquids to just soft foods because I feel like putting beans in a blender, they're already a little. Well, I don't know.
Right.
They're mushy.
I just smashed them with a fork.
Yeah,
that's what
exactly.
I did. Yeah.
So, but if your surgeon says you absolutely have to put it in a blender, go ahead and do that. We don't necessarily do that, and people do well with that. So get into your question about how the progression of food is helpful. Most importantly to me, I think of it from an anatomical aspect, meaning, at first your anatomy, whether it's sleeve, bypass, SADI, whatever, your intestinal tract is swollen. It's not going to really allow large pieces or chunks of food or amounts of food to come through. So liquids are going to go through easiest. You start increasing that viscosity to full liquids, then to soft foods. Then finally, after about 2 months, that 2 months is when I go to regular. Some surgeons may do that sooner. But, soft foods like the eggs, you finally get some flavor, you finally get some texture. And so most people are able to tolerate that for the 6 weeks that I have them on that regimen. Now, as far as what it's doing metabolically, I don't have any, really strong data on that, as to what it does, but it just seems like a natural progression of how your anatomy can tolerate increasing thickness of foods. And I think another really important thing, especially for our male patients and some of our female patients, it's, we forget to slow down and chew our food.
Yes.
We talk about that 30 chews per bite of food. People are like, oh my God, it's going to take me forever. Like, how am I going to get through a meal?
Yes.
It's not as important with the soft foods and the liquids because it's already kind of mushy.
Mm-hmm.
But now a month into it, 6 weeks into it, you're starting to really grasp, how, if you do too much or too fast, you get that feeling like, oh God, I can't take another bite.
Yep. It's like up here. Yep.
Yeah. Right. So, if you progress too soon, that's going to happen too quickly and you're going to feel lousy and you're not going to get the nutrition that you need. So thinner foods are going to allow you to get more nutrition. You're going to be able to get a little bit more in, and the anatomy is going to allow it to occur. So,
okay.
If that makes sense. That's kind of my best answer.
Okay.
Yeah,
so it's more about the swelling, like making sure that goes down before you really try to eat solid foods.
At least early on. And not only that, we have to remember that the staples that we use, the suturing that we use to create, to change the anatomy is fragile for up to, 10 to 14 days. Some of the potential complications, when we look at, like a sleeve leak or a bypass leak or things like that can occur up to as far as a month out from surgery.
Okay.
And so you don't really want to challenge that staple line too aggressively. And I think, if we're talking about why is this so important, one of the potential issues that could occur, it's very infrequent, so I don't want people to be concerned about it overly, but I do think it's important to realize that you can have a perfect surgery. And if you do something more than what you should, you could potentially cause a complication for yourself.
Yeah.
And I think that is probably the number one message we want to get across. The reason why we progress things slowly is because if you go too fast and you cause an injury to your staple line, that could get you sick for 4 to 6 months, maybe even longer.
Yeah.
Of multiple procedures.
Yeah, that setback. You just don't want that setback. I remember I was so scared to get off of my plan because okay, so this is how my brain works. Kelly's gonna laugh a little bit.
I've heard this
She's
before.
heard this. So I was so scared to break a stitch so then I would leak because in my head I'm like, oh my God, that's acid, that's biome. That cannot get on my organs. I will be in so much trouble. I'll be in pain. So I was like, I can't, there's no way. I don't want to bust a leak. And also I don't want it to be my fault. That was also another thing was I don't want it to be my fault that this freaking happened to me because all because I couldn't follow
because you
book.
were introducing things too soon.
Yeah. I just need to follow the surgeon and follow the recommendations. And that way, if it's on them, it's on them and they can make it work. But for me, I'd have to wait to figure out the pain would start happening. I'd probably start sweating, having a fever, all these things would start happening and I wouldn't know what it technically was from.
Did you Google what the symptoms of it would be?
No.
Okay.
No.
I just feel like that's the person that you are.
Oh.
You're I'm going to Google it because I need to know exactly what's going to happen.
No, because the Google doctor kind of scares me too. So
I don't Google any of my symptoms because they all come back and say I'm dying.
I know all the time I have cancers and I need to go to the hospital immediately.
I Googled lupus one time. That was a bad idea.
I did too. When you first got it, I Googled it.
Yeah, it's scary out there.
Because I knew it was scary and I was okay, I could have swore if you had lupus in the 50s or 60s, you'll die soon. So I was holy shit, Kelly has lupus. What is it
She's dying.
now?
She's dead.
I'm
Yeah, I Googled it once and I was like, no, bail out. I don't want to know any of this. So I just get all my information directly from my rheumatologist. I do not Google.
The professionals.
Yeah, they're professionals. They can fill us in. So
I have a patient who I did a revision on 5 days ago.
Oh.
And she came into the ER last night when I was sleeping. I saw her today. I go, okay, I know you. You don't always follow directions. What did you do? She said, well, I know you told me to be on full liquids, but I was doing so well with the soft stuff. I did that last night. And sure enough, she's in the ER and we're treating her and she's going to be fine. But I just said, I just know that you're not a rule follower.
Yeah.
And she proved it and she's in the ER. It's exactly what you're talking about. There's reasons why we have, protocols in place. And if you break those rules, you may have some significant consequences. So
Yeah.
I'm so glad you guys are bringing this up.
Oh,
Yeah.
us too. We were talking about it. And we were just like, I was like, we haven't done one on why.
Yeah, because
And we're big advocates of why.
And the consequences that come along with it, because there is always a reaction to your actions. So we need to balance it and make sure we're doing what we're supposed to be doing for ourselves. Because the whole point of this freaking surgery is for us to be better and to take control of our lives. And I get frustrated when I do hear people in the community that are like introducing things so soon, not even working out in the beginning, or even working out way too soon, where they're like, I'm on day 5, I'm gonna go walk a mile, and I'm like, no,
yeah, rest.
Stop.
That's what you need.
Put your feet away right now.
Yes. I mean, I've always been a advocate of like, if my doctor tells me to, I'm doing it.
Yes.
Like, because it's you guys are busy, and if you are wasting your breath telling us, okay, you need to do this and then this and then this, it's worth it. It's worth it to follow the direction. And like, I remember at ASMBS last year, we were talking to a dietitian, and she actually said that one of her patients put a candy bar in a blender. And said, oh yeah, I had a candy bar, but I blended it, so it was fine. And she's like, that's not the direction. That's not the direction we're going. So and ever since then, I'm like, oh, people really don't follow the rules.
No.
Like,
no.
They want to give their own spin on it.
And I think that we need to realize, like, hey, guess what? When we try to do it on our own before, where did we get to? I got to 308 pounds.
Yeah, I got to surgery. So like, we all ended in the same spot.
Exactly.
So let's follow the rules for the time that you have to do it. Because I always think it's a year. Yeah. You're giving it a year of your life where you're very committed, you're very into it, and you just commit to 1 year. And then after that, life can kind of start to get back to normal. You can start eating, more normal foods. You're exercising normally, like obviously if you don't have any side effects or complications. But for the most part, it's the first year. And if you can commit to that first year, you're going to be more successful than if you're month 3 and you're blending up candy bars or you're drinking alcohol too early, like, because in my mind, it was one chance. I had one more chance and that was it. And that's why I committed so hard to this process. And I know Mel felt the same way.
Yeah. I felt like I tried everything else and I felt like I was trapped in my body. And now I finally gave myself I found this thing that I can do it. One last try, this tool, hopefully it does it.
Was a gift to yourself.
And it freaking worked.
Yeah.
And it's because also that we put all of ourselves into it.
Yeah. I was told not to use straws, which we found out that is not that big a deal anymore. But I went over a year and a half without a straw. I was a year and a half when I drank my first sip of alcohol.
It was like 18, 19 months when I first had my drink.
Yeah, because it was like, she told me the first year and I was like, you know what? If I can just keep going, that works.
No carbonation for the first year.
Yeah, and carbonation too was another one.
What I try to tell people, it's almost like when you open a brand new game at home, like a board game at home, right? Like, you're not supposed to know how it works, right? You have to read the instructions.
Yeah, there's some that are really complicated.
You have to follow the instructions for the game to be fun and productive and be successful. It's the same damn thing.
Yep.
And it's okay to not know. I think people get really hung up of not knowing, and we're not supposed to know everything. Like, there's no way our brains cannot handle all that information. Only thing we need to do is know how to get to our resources. So we have to have people around us that can help and are willing to help. And that's you guys. Like Kellie was saying, why would you want to waste your breath if we're not going to listen? Like, you guys are very valuable. There's only a certain amount of bariatric surgeons, a certain amount of dietitians, therapists. And why would we, waste our own time, book the appointment, go to the appointment, and then be like, yeah, he's full of shit. I'm going to do what I want.
I do whatever I want.
I don't get the concept. And I feel like that's why we wanted to have you on and back to really explain why.
Because just your story of your patient being in the ER, like, it is dangerous to not follow the rules.
Yeah.
Absolutely.
It is straight up just stupid dangerous.
It is.
Like, you're being stupid if you're playing with your life like that.
Because you're worth more than that.
And what's funny is people are like, oh, surgery is so scary. And it's like, no, it's actually the stupidity of the people that is scary. Because the people are what, like, the surgery itself is it's not very invasive.
You're trained. You've been doing it for years. You're an expert.
Yep.
I'm down.
People go into gallbladders all the time. Like,
right.
Yeah,
exactly.
But it's the after. It's the after that you have to pay attention to. We all get that bariatric Bible when we go into our surgeon's office. All the directions are right there. If you just take the time and study it, like I did, I was a freaking nut house, and I had my little Post-its with all my questions, and I had arrows and highlight it.
I did not. I'm not gonna lie.
Yeah, I was a little crazy.
I glanced over it, but it's fine.
Which just shocks me that I was the researcher and she wasn't.
Because I love school, and I was actually going to college at the same time I was doing this.
Why.
Yeah, that's actually is probably why.
Yeah.
I was writing like 30-page papers and shit. Like, I had no time to reading this thing. I was like, yep, my doctor said this is my date. Don't do these things. Got it. Easy peasy.
Yeah. I had all sorts of questions. Well, I was also bedridden at the time too.
That's true.
So I had my little book in bed, and I just read through it, highlighted, had my Post-its with all my questions. And when I went back in, she's like, you're very prepared. And I was like, well, I don't really have that much else to do.
Yeah.
So this is what we're doing.
I think it is very helpful to get to know that and pay attention to it. The other thing was about exercise. You mentioned that briefly about getting back to it, because everybody's so motivated after their show. Like, oh, I can't wait to, get out there. And there's some rules about that as well.
Yes.
And really probably most important is you stay hydrated. You don't want to overdo it. Like you said, getting out and, jogging 10 miles for the first time, you're going to be sore, you're going to cause some issues. But I think one of the other things we want to talk about is weight lifting afterwards, and doing too much aggressive physical activity, because the incisions are healing just like your anatomy, your intestines are healing, or your stomach is healing. And if you overstress that, you could potentially pop one of your incisions, which could then lead to a hernia. And in some instances, that could require an emergent surgery soon after your bariatric procedure. So,
which is very expensive. Just FYI, emergency surgeries are way more expensive than just your doctor's appointment. Just FYI.
For sure.
Sorry, keep going.
Oh, that's okay. Yeah. So, so most people say no lifting over 10 pounds for about 6 weeks. The body heals kind of like aggressively for 6 weeks, and then it planes off for the next 2 years. But in that 6 month time frame, 6 week, things get probably 90% as strong as they're going to be long term.
Okay.
And maybe it takes another 2 years to get to that 100% as strong as it's going to be. Always weaker than what it started out with. But, giving it that 6 weeks break before you do anything over 10 pounds, or, that's basically a milk jug, before you get aggressive into, doing the house chores and that type of stuff. So really try to take it easy initially. Take the time off from work if you need to, because finally, like I said, like you guys are saying, is you've done something for yourself. Take advantage of it, and follow the rules.
Yeah. Why is it so important for people to do lift weights after they're clear?
Yeah, the strength training. We hear it a lot.
Yeah, strength training. Yeah. Why is it so important for us to do that?
So both cardiovascular and strength training have their benefits. And what I was doing, I didn't used to do a lot of exercise. Then I got on the pedal bike, and I was doing a lot of that. But I realized that I was changing, and it relates. And then so I started introducing weight training, and I noticed a significant improvement in my overall cardiac health, my weight loss associated with that. Weight training, what it does obviously is it builds muscle, and if you have the resting metabolic rate of muscle is more than fat, so you're naturally increasing your metabolism by building muscle, because it takes more energy to keep a muscle cell functioning than it does a fat cell. So as you build muscle, you're increasing your metabolic rate, or your metabolism. So, just your resting metabolism, if you've got more muscle, you're going to burn more calories than if you have less muscle. Does that make sense?
Oh, yeah, sure.
Yeah. So adding not only cardiovascular training to your exercise regimen, but weight training. Now, I said, weight on the heavy weights, but there's nothing wrong with picking up a 2 or 3 pound weight after surgery, as long as you don't feel like a strain of your abdominal wall, as long as you're not like grunting or pushing or straining.
Okay.
So 2 to 3 pound weights, high reps. If you're doing like 15 reps with a 2 to 3 pound weight, you're going to start to build muscle, or at least tone your muscle. And that's something you can do early on after surgery, at least in my program.
Okay.
Obviously check with your own surgeon, make sure they're comfortable with that. It's a great way to start building that metabolism, increasing your muscle mass, which builds your overall metabolic rate.
So you say after 6 weeks you allow it? Is that what I understood? Or is it 8 weeks?
Or over 10 pounds, even right away. I mean, if people want to start, putting like 1 or 2 pound ankle weights on, or doing like little dumbbells, less than 10 pounds, start slow, obviously.
And nothing like crunches or anything like that. Yeah, obviously.
Exactly. Stay away from that. Anything that's going to tense the abdominal wall. You want to relax on that, because maybe you had a hiatal hernia repair, and just the incisions themselves are healing. And so you don't want to stress those until a good 6 weeks afterwards.
Okay. I think mine was 3 weeks. So that's
for what?
For working out.
Oh, mine was actually like 8 weeks. Yeah. 8 to 9 weeks.
That's so funny how different it is.
Different.
So,
yeah.
And I say, I think most surgeons say 6 weeks, hoping that they'll get 3 or 4 weeks out of their patients. So that's a little inside scoop. So let's go with the 6 weeks.
Yeah. Okay. 6 weeks.
Go.
I feel like 6 weeks, that's doable. Like, I feel like you did have a major surgery. While it is not, super invasive, it is still a major surgery. And you need to, I feel like some people just need to be told, sit your ass down and just be there for a little bit.
Like you can walk.
Yeah, I walked
do all the walking you
hour
want,
after
man.
surgery.
Put those weights on your wrist and your ankles.
Yeah, I didn't even think about those.
Yeah, I totally forgot about that. Like that would be easy.
Just kind of like moving your arms just along with it.
Yeah, once you're out of the hospital, then do that. Yeah, I was like doing my little thing in the hospital. I did many laps.
I did not.
I did many
but we did find out like our surgeries were different too. So like, yes, I had, cause we both had sleeve, but I only had that 24-hour of the liquid. And then what Dr. Patterson said was that like, I have a pretty big incision right here. And she said that she pulled my liver out. So I was like, oh, this is why this hurts more.
Yeah, because she had a lot more pain than I did. And I was like, I don't understand why you had so much pain. Like, because she told me she had so much pain. And so I was prepared for this high level of pain. And then I was like, oh, I can walk. No. I can do all of these things.
I was like, you're walking?
Yeah.
Oh my God. I didn't start walking till like day 3 or 4. Like this is wild.
They were like, as long as you're, my now ex-husband, they were like, as long as your husband is next to you and make sure you're not falling, like, that's all we care about. And so I was like, okay. Because I was sitting on the edge and they're like, what are you doing? I'm like, I want to walk.
You're like, I want to get up.
I need to go walk. I have the gas pain and I want to move because I did some research and I remember people always saying like after surgery, just walk. So that's what I did. Yeah. So can we touch on like alcohol?
Yes.
And why it's so important to wait as long as your program says to wait.
Or longer.
Whatever.
Yeah. For a couple of reasons that come to my mind. And one is, first of all, just the anatomic change that occurs with either sleeve or bypass, any of them can have differing effects on it. One is, in not any specific order. One is alcohol is going to hit you a lot harder. You may not be used to its effect. You may be in the past, you could handle a couple of cocktails. Maybe now it's half a cocktail and you're going to feel the effects.
Yeah.
That may impact what you're doing that day. Hopefully you're not driving, and all those issues. So number one, safety. Number two, we know the caloric content of alcoholic beverages is significantly higher. And there are those empty calories that really don't have any effect. So I think that's the second part. Third part is for sure the risk of transfer addiction. Some people have issues with, before food was their comfort. Now post-surgery, they can't turn to that like they used to, but they can drink alcohol. And next thing, alcoholism becomes an issue. And so I think those are the three main reasons I recommend staying away from it. And they all have differing impacts and how it may impact our life. But alcoholism after bariatric surgery is certainly a thing.
Yeah.
And, I look at, alcoholism and drug addiction. I mean, nobody ever wanted to be in that position. No one ever wants to become an alcoholic. It's just, it becomes a coping mechanism. It becomes a transfer addiction where, I had a rough day and now I'm just going to have a cocktail or something like that. And then it becomes 2, and then it becomes 3, and then it's daily. Then it's throughout the day, and you're doing things that it's just terrible for your health long-term. So, there is a happy medium, obviously, that we find afterwards where, you now realize, okay, maybe I can tolerate a little bit. Hopefully you learn to control that. But again, the calories, when I see people stop, even non-surgical patients, but when you stop drinking, people are going to lose 10 to 15 pounds.
Oh yeah.
Depending to, at what degree they were drinking alcohol. So
I have 2 questions with that. Okay. So one is, alcohol is a toxin, whether we want to believe it or not. Is it doing anything, like when you do it in like the younger stages of this, like, is it hurting your stomach lining, your intestine lining? Like, is it doing anything that it, like, we don't really think about?
It absolutely is a gastric irritant or a stomach irritant. So it increases the risk for ulcers, what we call gastritis or irritation of the stomach. And so, yeah, that's a great point that I didn't even bring up, is that while things are healing, certainly early on, can delay healing, but it can also cause new ulcers. So reflux is a big problem that alcohol can induce, as well as the irritation of the stomach or gastritis. So for those reasons, again, great reason to stay away from it.
And how long do you recommend in your program?
I was going to ask that.
I say as long as possible or forever. What I mean? If you can handle it in moderation, then okay. I would say, wait at least 9 months to a year. I mean, I like that 1 year mark, Kellie, that you're talking about, is that, let's do everything that we can for ourselves to improve our health for a year. We can stick to it that long. Day, just like the 12 steps, one day at a time.
Yep.
We can get there today. We can get there. Tomorrow's a new day. And if you have a setback, that's all right. Tomorrow's a new day. Let's start all over. But let's give it our best shot at that first year, to give our body really a chance to do everything we can to improve our overall health.
Yeah, because I think if you tell yourself, because if you look at it and you say, if you were told that if you gave it your all for 1 year and your life would completely change in more ways than you could even imagine.
Yeah.
Would you give it that 1 year? I would.
I know a lot of us would. Well, and people need to think about the 1 year out of the big, grand scheme of things.
Yeah.
I know I want to live to at least somewhere in my 80s to 90s. One freaking year.
80's pushing it for me.
Well, we know. We know.
We've already had discussions.
About that. But 1 year, guys, is like nothing. It's like a drop in a hat.
Yep.
What are we doing here? And then if you just keep going, then all of a sudden you're going to live longer. The whole point is to live. At least my point was to live longer.
Yeah.
My dad died at 59. His whole family never reached 70. So this is a big deal for me and my brother, who both have had surgery, is to trying to outlive our freaking family, basically.
Yeah.
And if we can do that by taking a full year or two, just focusing in and making sure we're healthy, then do it. Just do that 1 year to the fullest, because it does help your behaviors later. I'm 8 years out and I've only gained 20 pounds back and I feel great.
Well, and that I don't even consider that, because it's more like a bounce back.
Yeah.
It's you're going to do that anyways, naturally.
See, and I didn't know that either. I was very hard on myself. I was very mean to myself. And I thought that I was just a failure because I couldn't keep it to the bottom level. And then I realized after hanging out with Kellie after hers and talking to all of you guys, I'm like, oh, this is normal.
Yeah, it's totally normal.
I've been just beating myself up for over a year. It's totally fine.
We as patients just want to get down to the lowest that we possibly can get, because it's for the first time in most of us, we've never seen that number except for when we were a kid.
Yeah, same.
And some people didn't even see that as a kid.
Yep.
So it's exciting to get down that low, but you also have to realize your body might not be meant to be at that level.
It's true.
So
it's very true.
It's It's
That is so
totally
true.
okay.
I agree. No, yeah. And, you know, getting back to the research is that after bariatric surgery shows to increase your lifespan by at least 10 to 15 years. Some people 20.
There you
So you
go.
know
There
what I
we
mean?
go.
It's let's take that 1 year and get us those 10 to 15 to 20 extra years.
Yeah.
You know, what we normally would have or otherwise would have lived.
Yeah.
That's
Yeah.
amazing.
That's the question is like, if you give it all for a year and you knew you could live until 100, wouldn't you do it?
Right.
Well,
I mean,
yeah,
I
'cause-
wouldn't
well,
because I don't want to be 100, but
think about all the extra experiences, all the people, all the things that now you get to do because you focused in on yourself. The other question I have for you too is that we hear this about carbonation for the first year. My doctor was about that too. Do you have the same feelings about carbonation? What do you think?
I think early on, it's certainly a problem. I would say probably for the first couple of months while things are healing, you probably want to limit it or eliminate it. Beyond that, I'm a little bit more liberal with that. But early on, now that our anatomy is reduced from our large stomach that had a reservoir for air, now with our smaller pouches, whether sleeve bypass, whatever procedure, there's not as much room for that air, and that it's either going to make you feel uncomfortable, that's going to give you bloating. I really find it hard to imagine that just carbonation is going to cause a stretch out your. We used to say that.
Yeah.
We didn't really have much research behind it. It's like, oh, it's going to stretch your stomach. You've got ways to get rid of gas. It's either going to go downstream, it's going to come up, and you're going to belch it. It's hard to think that air can distend it. So that's, that my thought is, let's let things heal initially. If there's other things that are involved with the carbonation, some people may have better science behind that, but I found that, give the first couple months, allow things to heal. And then thereafter, I'm a little bit more liberal with it.
Okay. And the concern,
you don't want to do it every day.
The concern with carbonation is more of like what kind of drinks have carbonation.
Yes,
right?
I was going to point that out because my doc was not really about she's like, hey, we get it. People like carbonation, but also most of the drinks that people have with carbonation are not good for you. You're just drinking, again, calories and sugar, whether that's beer or sodas or juices. So
ciders. Yeah. I mean, I drink carbonation, but that's it's literally bubbly water.
Yeah. You drink bubbly water.
I just don't like flat water.
Yeah.
And I have come to grips with that. And that's what I drink. But I also waited over a year and a half. I remember selling my Soda Stream and I was so sad before surgery. I was so sad because I loved my bubbly water. And then I was like, okay, I'm just not going to have it forever. And because the research that I did, everybody was like, oh, it'll stretch your stomach back out. And I'm like, I don't want to stretch my pouch. No.
This is new.
Yeah. And then once, we started the podcast and I was like, oh, that's not accurate.
Yeah.
Okay, cool. Good to know. Good to know. And that's why we do these episodes, to get the real information out. So, one more question is therapy. Therapy after surgery. Do you require it in your program before and after, just before? And why is it so important? I know this isn't harmful to your system, but I think it still needs to be addressed.
Yeah. What I always thought is, you don't know you need therapy until you need therapy. You know what I mean? You're like, hey, why are these people going to therapy? And then you realize, oh yeah, now I get it. When you yourself are like, okay, now I understand it. And so I think it is so important to have someone to just chat openly with, a friend maybe too supportive or too argumentative. Having that third person voice who's just going to kind of listen to you, taking what you have, not be judgmental, but giving you good advice based on, what they know or what they've learned in their training is super important. I think we have the tendency to go back to old habits. And so having someone where you're going to continuously talk with about what's going on in your life, they're going to spot those things and maybe say, hey, don't forget, this is why we had this procedure. This is why we did this in our life to avoid these types of issues. So most insurances actually require it for prior to surgery.
Yes.
Which we as a society are really trying to fight that. The insurance companies are saying, okay, everybody who has the disease of obesity must be crazy. You know what I mean? It just doesn't make sense that, we have to have a psychological screening in order to have the surgery. I mean, for the most part, I think, you just look about anybody you walk across in the street, they're going to have an issue that needs a therapist for sure.
Yeah. Everybody's
1000%.
got some type of issue that you need to work out. Yeah.
Right. So number one, I think everybody should see a therapist. And if you think you don't need a therapist, you're probably wrong. But, so for my program is, insurance requires it. And then thereafter, it's kind of, I like to sit down and talk with my patients afterwards and, how's everything else going? Stressors in family, you're going to have the family members who are not supportive of what you did. You're going to have spouses that are not supportive. And I always say, bariatric surgery makes a good marriage good or a bad marriage worse. So good marriage better or a bad marriage worse. And, I think therapists are going to help you sort that out. So important just to get that support when you need it. I don't necessarily mandate it because you can't force people to go to these things, but I always strongly suggest it because I think it's so important to talk about all those other issues that factor into our life, that factor into the disease of obesity that can be addressed simply by talking about it and reinforcing it.
Yeah. I mean, actually next week I hit my 1 year of therapy.
Nice.
Yeah.
Congrats.
And thank you. I actually cheered when he told me that.
Yeah, you should.
I had therapy this morning. But I didn't realize how much I needed that third person because obviously like I talk all the time. I talk to Mel, I talk to interview, when we do interviews. But when you're talking with a third person, especially when you're battling a disease like obesity, you're constantly in your head. And when you have surgery and you're battling it, that voice I feel gets stronger because you're trying not to go backwards.
Yes.
And so having that third person to talk to and kind of have that de-stressor, because that's where I find I eat is when I stress. And so if I can help with that, and then, also all my other trauma, it's a fun life. Talk about that, work it out. And then you can kind of let it go. You can kind of put it there. Okay, I've dealt with that one. Okay, we're going to move on to this one. And I know Mel's done therapy and feels the same way. So.
I do, because it was a shock to say things and not have a reaction. That was so powerful for me because I'm used to having like someone that's either criticizing me or judging me.
Not me.
Oh, no, not you. Not at all you.
Just want to point that out. It is not me. Don't yell at me.
No,
don't come at me, people.
There are two pivotal people in my life that do those things to me. And I really needed to see, hey, what I'm doing actually is okay. There, you should not be criticized or judged for this. Keep doing what you're doing. And I felt like also it's like a brain dump. Like I'm allowed to download my problems onto something else.
Yeah.
And it's nice that it's not a friend or a family member. And I can just say the things and still get that blank stare where it's like, okay. And I'm like, oh, you've heard crazier things. Cool. That makes me feel
so true.
I feel a little bit better about myself.
Yeah. You're not crazy.
Yeah. And
you just have feelings.
And exactly.
Right. It's okay.
People act like because you have feelings that there's a problem. And I have to always go back and be like, no, I'm fucking human. I'm supposed to have problems. I'm supposed to have feelings. Like this is normal reactions. Like the fact that you want me to be calm, I feel like is a problem in itself.
Well, and I always say like, I'm allowed to feel frustrated about what you said. I'm allowed to feel sad, happy, whatever. I'm allowed to feel like that. You don't have to take that on because that's my feelings and my thing. But I'm allowed to feel whatever feelings. And believe me, it's taken a full year to get to this point for me to say that. Yeah. I am allowed to feel my feelings. And it is okay that I feel about.
And she feels like other people too.
And I do.
Allowed to feel their feelings.
Yeah. It is okay to feel your feelings. And I think that's one of the biggest things is we try to stuff our feelings down before surgery. And then after surgery, we can't really do that. So you need a place to go to make sure that you're feeling those feelings and talking about those feelings.
I have personally had panic attacks, anxiety attacks because I can't eat my feelings anymore. And I don't know what to do with all of this like pressure and stress. Like I talk about all the time, there was a pivotal point where I was just in my door frame of my bedroom and I was just crying. And my ex at the time was like, "Are you okay? What's going on?" I'm like, "I have no idea. Like, I don't know what the hell's happening to me right now." But I just like fell to the ground and just cried because and then I realized later it's because I was so upset with a situation that I could not go eat. I couldn't stuff myself and I actually had to feel the feelings. And I think that a lot of us numb ourselves, whether that's food, alcohol, gambling, sex, shopping, we try to numb ourselves. And I think if we actually just took a time to like slow down, feel what it is and ride the wave, you're going to feel a lot better.
Exactly.
And it's not an all day wave. I hear people have, "I cried all day." No, you didn't.
No, you didn't. That's physically impossible.
Yeah.
You cannot do that.
You cried for like 10 minutes and then you thought about it all day.
Yeah.
That's what you did.
I mean, I feel
So,
like
that's
I
fine.
have cried for like a half hour straight, half hour, 45 minutes.
Yeah. And I'm a crier. I haven't.
Yeah, but you're a quick crier.
I am.
You're like, tears gone.
Yep.
Yeah.
Yep. It's true.
I
It's
do
true.
want to point on that saying that you just said. Good. It makes good marriages good
I knew
and
you were.
bad marriages bad.
Yep.
So
Yeah. So let me just, because I like my buddy, actually, I learned this from my trainer, Dr. Marshall. He said, makes good marriages better and bad marriages worse.
Yeah.
okay.
Yeah.
Okay. That's how we say it.
I like that. Yeah.
So my question is there any research that says that there is a higher divorce rate in bariatric after you've had bariatric surgery?
I would like to say I've heard that. I can't necessarily quote the statistics, so I don't want to give out false information, but I've certainly heard that. So I would lean towards, yes, that is correct.
Okay.
Yeah.
Okay.
And I heard it too. We read that it's almost the same as any normal divorce rate, but also I believe that it is higher because now everybody that got surgery has to feel their feelings and then actually have to talk about it. So now we're at a different
the
level.
divorce rate, we know the overall divorce rate is 50%. I mean, but what I've heard and how that impacts that is just that in the past, sometimes the disease of obesity has kept people down. It would allow the spouse to belittle them or whatever. And then you change your life for the better and you get more confident and you're just like, I don't need this harassment anymore. I'm my own person. I've done something great for my life. And if you're not happy with that, then F off and we'll see it.
Yeah.
That's what I think it is.
Yeah.
I think some people say like it's because they go crazy and like they want to sleep with other people. I think it's more of like you're with this person, but then you turn into this other person that you were always meant to be. And then you look back and you're like,
it's a settling thing. You settled.
Yeah.
You thought that, I know me personally, I thought I was too big to get anybody better. So I just might as well just be with the father of my son. That's exactly what happened.
You fixed that.
And I'm in the process of fixing that because I realized we weren't meant to be together.
No.
Right.
And it's fine. I do want to touch on two things before we let you go. Is the last two pillars, which is sleep and vitamins.
Yes.
Yeah.
Can you tell everybody why sleep and vitamins are so important to be successful?
Yeah.
Yeah. So let's start with sleep. I mean, we are biorhythms that our body, lives on, and the diurnal cycle of how our hormones react have everything to do with our fitness, our weight, our stature, and our overall mental health. I mean, it's just so important that we get that sleep that our body needs. Some people need more, some people need less. But when you force yourself into an abnormal pattern, you're certainly interfering with those rhythms that occur. So, when your sleep cycle is supposed to be a nice arc and then all of a sudden you abruptly cut it off, there are hormones that were meant to kind of fade off that are going to allow the cellular structures to regenerate, to repair themselves. And when those hormones are cut short, then those repair cycles can't necessarily happen. And that's why, my one kid who slept great is, he's much taller than all of us. My one kid who didn't sleep so well, he's shorter. We know that sleep impacts a lot of different aspects from our stature to our overall health. So absolutely key to healing. Your body needs sleep to heal. That's when we're sleeping is when our body is regenerating all the damage that's been done to it all day. So number one, you need that just to heal. We have all kinds of disasters going inside of our body, 24/7 during the day, but the sleep cycle is what allows that process to heal. And so we can't stress enough how important sleep is, and regular sleep. And I know, people who are doing third shifts and they're up all night and sleeping during the day. If you do have to do that, there's ways to combat that so that you can kind of reset your body. You want to sleep in a very dark room during the day. When you're awake, you want to be exposed to light. And if it involves, an ultraviolet light that's going to give you some vitamin D, we know how important that is to cellular function. If you are forced into these abnormal rhythms, there's ways to combat that so that you still have the health that's involved with it. But when you're doing it regularly, it's just a bad idea. So make sure you're getting exposure to daylight, or at least some form of natural light that's going to help with your healing cycle, but also get the sleep that your body needs. I mean, ultimately, you should be able to wake up without an alarm clock. That would be the ultimate goal. Now, for me, that means I'd wake up at like 11 o'clock in the morning, but I have to kind of shift my cycle every once in a while. But that's why sleep's important.
Okay. What
any
about
comments
naps?
on that? Naps?
Naps.
Look at outside of the U.S. I mean, just about every country has siestas and taking naps. I think it's. I wish I could.
Right.
I think it's a great idea.
Okay.
So if you have the opportunity to build that into your daily schedule, as long as it doesn't interfere with the evening. So if you take a 3-hour nap during the day, and you don't go to bed until 2 a.m. and wake up at 6, that's counterproductive.
Yeah. Okay.
But get a little, a half-hour snooze in. I think that it rejuvenates you. I think it adds energy. But if it's going to interrupt your evening schedule, then it's probably not a great idea.
Okay. So naps after surgery, though, like right after surgery, do you, because we should be sleeping as much as possible after surgery, right?
For early on, it's when your body's repairing itself and when it's healing. So I don't necessarily say you should take a ton of naps afterwards, but if you're going to, do it.
Okay.
You got the time off. But this may be the first time that people have actually had a week off in a long time. So take advantage of it. It's like a mini vacation. Get the sleep you need. Make sure you're getting your nutrition, your supplements. If we want to touch on that in just a minute.
Yes.
But doing all the things that your body needs to recover: sleep, hydrate, vitamins, nutrition. Are all really paramount to overall healing.
Yes,
it really is. And the sleep part, I will say, is like one of the biggest deals that I see all the time, because I have a lot of people around me that have like insomnia or sleep apnea to my left. And so like, I know I feel 10 times better after I've slept that good 8 hours. And if you guys are taking 1 week off, 2 week off, this is a great time to fix your sleep cycle, because you're already off anyways. So if you're getting your nutrition in, and you're getting your water, and you're getting your supplements in, and then just get that sleep.
Just work on the sleep schedule.
Work on the sleep schedule. So that way you can be prepared for going back to work or whatever your day-to-day stuff actually looks like.
Exactly. And yes, I'd love to touch on vitamins, because it is dangerous not to be on your vitamins.
Yeah, it's like the Wild Wild West out there. People are like, I take Flintstones. And we're like, no, stop taking Flintstone vitamins.
Don't even get me started on the freaking Flintstones.
I know.
I can't with the Flintstones.
My number one comment is, one is better be taking something than nothing.
Yes.
But I share your passion for that. The vitamin supplementation, as supported by our national organization, all the research, it says based on the anatomical changes, your body can absorb the natural vitamins and minerals that you need for daily function through food alone, because there's just not enough. If you have some type of a bypass procedure, you don't have as much absorptive surface. If you have just a gastric procedure, you may not have the factors that the body needs to break down those foods. For instance, B12, we talk about this. Everybody needs B12 if you've had some type of bariatric surgery, because one, we have a factor inside of our stomach that you eat B12. Let's just say you take a chunk of B12 and you eat it. Now, if you don't have what's called intrinsic factor in the stomach, which breaks down the B12 into absorbable factors, it just passes through the system. So through the anatomical changes that occur with surgery, we need to supplement our body in different ways. So the B12, for instance, we can't just swallow it because it's going to not be necessarily broken down. Now, some people can get away with it, but we just assume everybody needs it. So you need to put a tablet under your tongue, a shot into your arm, nasal spray, so it's absorbed other than through the intestinal tract.
Okay.
More important with some of the bypass procedures, but some sleep patients do have enough of that intrinsic factor that it does break it down. But by the time you find that out, it could be too late. So we suggest everybody gets B12, everybody gets calcium, everybody gets a multivitamin. Most people need iron as well. And if you have any of the really significant malabsorptive procedures like duodenal switch or SADE or those, you're going to need a few more vitamins that are the fat soluble vitamins A, D, E, and K.
Yes.
Okay.
So
yeah.
Right.
I know that ProCare has a vitamin that they have formulated just for
The
SADE
SADE.
and the DS.
Yep.
So, and it has those extra ones in there. So I really enjoy that you can, no matter what surgery, you can find it on their website.
Yeah.
And
Because
and get
I
what you
take
need.
the
And
one with iron and you take the one without iron.
without iron. Yeah. Because I have high iron. And they also have a prenatal one.
Yep.
Which is cool. It's for those patients that get pregnant after, because that's their whole reason for having surgery is to get pregnant. So yeah. Because there's some dangerous side effects that can happen if you do not take your vitamins.
Can you touch base on some of those?
Yeah. Well, any of the vitamin deficiencies are going to potentially cause problems with overall cellular function, your ability to heal. I mean, as we know, there are cancer cells generated inside of our body every day that the body's autoimmune system destroys and takes care of. Now, as you start to impair those healing cells by vitamin deficiencies, you could potentially be initiating other problems to develop in your body. So, our vision is important, to this vitamin supplementation is important to our vision, to our bones and our overall bone health. We see people who don't take their supplements having fractures like hip fractures and rib fractures and just things that are otherwise miserable to deal with. And so if we can take our vitamins to support our overall health, it's going to prevent long-term problems.
Yeah. Because we've heard of people having blind issues, like
not being able
temporary,
to walk.
temporary blindness. Their gait, like the whole walking was a problem. We had someone on last year that is beriberi.
That was like 2 years ago, wasn't it?
Something like that, which is like a vitamin deficiency.
Vitamins. So B vitamins are very important to our neurologic health, meaning, some people will get numbness in their feet if they're not getting enough B vitamins. Like you said, the gait, not walking well, other neurologic issues like nystagmus, blurred vision, that type of thing. So
yeah.
Those are also important.
So go and get your vitamins.
Yes, guys.
Please.
Go,
and
go,
make
go.
sure. How long after surgery, I got it, should people, or do you recommend your patients to start taking their vitamins?
I usually say within the first couple of weeks, if you did well nutritionally preoperatively and you're doing your protein drinks pretty quick afterwards, they have enough supplements that you're not necessarily going to run into problems. And those first couple of weeks when you're not feeling so great, you're still maybe a little nauseous, things are irritating your stomach, maybe it's not the best time to start. So I say within the first week to 2 weeks when you're feeling up to it. So start slow. I think most important is a good multivitamin. When you're tolerating your multivitamins, then start adding your calcium. Once your bowel functions back again, you can throw in the iron. Just some of these things that are we know iron can be constipating.
Yes.
So if you're already struggling those first couple of weeks because you're dehydrated, don't throw iron in there because then it's going to be even more miserable.
Exactly.
So,
and do you recommend chewable or tablets? Or the capsules?
Chewable initially, I think, are easier.
Okay.
So, whether it's any type of chewable is going to be, I think, more tolerated early on. When you can start to tolerate regular pills, if you can tolerate, a regular size multivitamin right after surgery, I think it's fine.
Okay.
If it's one of those huge honking ones, you're afraid it's going to get stuck, then definitely break it in half or crush it up or just get a chewable. I say the easiest thing, just to kind of straightforward, is chewable for the first 2 months. By then you should be able to go into regular stuff.
Nice.
I like it. Yeah.
I like
That's
that.
a good rule.
Yeah.
All right. Yeah. I think we covered everything.
I think we did.
Yes.
That's
So
great.
I hope everybody is listening and hearing all of the dangers. So follow the directions that your surgeon gives you.
I think that's the biggest key.
And commit for a year.
Yes. And go over and follow TREO because we want you guys to check that out because they are literally there for us, guys. Remember, it's treatment, research, education for obesity.
Yes.
So,
and yes. And we will have all of that linked below.
Yeah.
So make sure that you go and click on their new website and click on the Instagram and all of their social media platforms.
That's right.
And make sure that you're getting, because you guys do a newsletter on email newsletter.
So that's part of our rebranding, maybe part of that. But I think what we really changed the website, www.treofoundation.org, is going to have up-to-date information as to what's happening. And just to, for patients, if they ever want to give back because they feel grateful towards their surgeon, you can, donate a few dollars under your surgeon's name. And it's all going to go towards research that's going to continue to improve the surgical aspects, how it's impacting our lives. And so, going on there and clicking on and contributing is a great way to give back.
Oh,
awesome.
I love that.
I love that. I did not know that.
No.
So I'm excited about that. All right. Well, thank you so much for being on again. It was such a pleasure to talk to you. And of course, we'll probably have you on again.
Love to see you guys. Can't wait to see you in Las Vegas and then in DC.
Yeah. All right. We love you guys and we will see you next time.